My story is unique in that it had nothing to do with remdesivir. It had nothing to do with ventilators. It had nothing to do with the protocols. In fact, my late wife didn't even have COVID. But there's one thing that ties between my story and nearly every story you will hear today, in that it is the biggest, I believe, key to preventing this from happening again. My late wife dealt with health issues nearly our entire marriage. She had lupus, rheumatoid arthritis, and in 2014 she was diagnosed with pulmonary hypertension. When she was diagnosed with that, her doctor basically gave her 10 years, said she could be gone. So when COVID happened in March of 2020, we took it really seriously. But that very weekend that the NCAA canceled their tournament and the NBA paused their season, she thought she had COVID. So she got tested that Monday. And when the test came in as a negative, because I started exhibiting some symptoms, her doctor thought it still could be COVID, and so she was only treating her virtually. Anyone, any doctor here in the room, any nurse, anyone with common sense will understand that you can't diagnose a lung infection that's developing into pneumonia and then sepsis over virtual visits. So April 29th, 2020, at 3 in the morning, she woke up throwing up, not even able to keep a sip of Gatorade down. And we knew at that point she needed to go to the hospital. She got tested for COVID, it was negative again. I got tested for COVID that very day, it was negative. And I thought, sweet, okay, I'm negative, she's negative. I know all of her doctors, got really great relationship with them. I know a bunch of those nurses, we have a great relationship with them. They'll get us in, they'll get me in. Nope. So I called the hospital and I said, what can be done? Nothing. The only exception they would make was for imminent death, which is a judgment call. Didn't matter that I had my own PPE from changing her Hickman line. She had a Hickman line going into her chest, pumping in meds 24/7 to open up those blood vessels. Didn't matter that I had done such a good job changing the bandaging around that Hickman line that I had cut her infection risk by more than 2/3. Most PH patients get one infection every year. This was only her second infection in 5 years. Didn't matter that I was willing to pay out of pocket for hospital, a full suit, or daily COVID tests. Didn't matter that I was willing to abide by whatever restrictions they wanted to place on my movement around the hospital, anything like that. So as those days piled up, I had a bunch of friends that started sending me social media posts saying, this is going on. Here's a story of a 7-year-old in the ER. Mom wasn't allowed to be with him. They wouldn't even let the kid have his teddy bear. And I started sharing this. And then a buddy of mine that I used to work with at Focus used to be the director, the vice president of public relations. He has his own PR company. And he sent a blast out to 750 reporters. I started getting bites all around Colorado, even a little bit outside. And I started this big media push to let people know people are dying in the hospital alone. So the media was starting to pick up so much that my mom came out from Wisconsin. I grew up in Wisconsin, live in Colorado. So my mom came out to help out around the house. And because she was flying into Denver International Airport, and my drive goes right by University of Colorado Hospital, I thought, okay, what's the least harmful thing I can do? Do I just drive by and drive back, seeing the hospital from 225? And make no acknowledgement? Or do I try and make this something special because it's 2 days before Mother's Day? Do we go up a little bit early, bring the boys, grab gyros from our favorite gyro place, sit outside the hospital, FaceTime over dinner, and then wave to her from the car? Hopefully that'll encourage her. At the end of that call, she got super emotional, and whenever she got super emotional, her health would dip. 2 in the morning that night, I got a call from the hospital. Your wife is bleeding in one of her lungs. We're moving her into the ICU. Don't come up. 2 hours later, we think we've isolated. It's a couple small arteries. Don't come up. Ten days later, on May 19th, 2020, we got word she was going to be coming home on the 20th, 21st, or 22nd, but it was looking like it was going to be the next day, the 20th. So we had a quick 10, 11-minute FaceTime call. What do you want to eat? What do you want for takeout? Who do you want to come over? We want to shower you with love and attention that you've been denied these last 21 days. Hung up. 30 minutes later, I got a call from the hospital. And I thought, sweet, I'm picking her up tomorrow. Maybe I'm picking her up tonight. Instead, it was a nurse telling me, your wife has gone into cardiac arrest. You need to get up here now. 90-minute drive. I didn't make it, obviously. I have so many questions. If she would have been seen in person by her doctor, would my boys still have their mother? If they would have allowed reasonable visitation, she would have gone to the hospital sooner. Would I still have my bride? If she would have been allowed to be wheeled out to see us on Mother's Day weekend? Give hugs? Would her health have dipped that night? I don't think so. And at the very least, if everything still would have played out the way it did, in those minutes between when the nurse left her room and when her doctor walked in and saw her choking, gasping for air, when the pulmonary embolism hit her lungs, and no alarm was going off, would me have alerting them saved her? Would that have given them enough time to save her? Ladies and gentlemen, the biggest key, I believe, for all of this being perpetrated was the isolation. Visitation is the biggest key. That's why I created the Never Alone Project. We're mobilizing a grassroots movement to highlight the dangers of medical isolation, so ultimately we can see federal legislation that protects a patient's right to one screened loved one per day, no matter what's going on, no time limits. We've seen legislation happen in some states. In Colorado, on our fourth try, amazingly it squeaked through. But so many concessions were made that even Democrat Governor Jared Polis, before the signing, told me more needs to be done. Here in Texas, we have legislation, but it can be overwritten by a doctor. And all we know is it takes an administrator to decree from on high saying no visitation under penalty of your hours being cut, your patients being cut, or even your employment being terminated. Florida, Governor Ron DeSantis stood up and championed from on high, we have no patient left alone legislation. To much ballyhoo on social media, and even got some national media attention. Did you know it only guarantees a daily 2-hour visit? 2 hours, what about the other 22? Even in Arkansas, where we have the closest thing to nearly perfect legislation. Last year I had a conversation with Representative Julie Mayberry who got that through. Arkansas was the first state to get real substantive legislation pushed through. Colorado, we had some, we were the very first, but it was just it was gutted, so much so that it was completely ineffective. But in Arkansas, it's really, I believe, as close to gold standard as it comes. But I was talking with Julie, and she said, Steve, we got 2 problems. 1, no one knows about it. And 2, there's no real punishment for the hospitals. And so they're still locking people out, basically daring people to find out about it, and often people are afraid to report it because they're afraid of retribution in terms of quality of care. At the federal level, Congressman Andy Harris from Maryland and Congressman Jeff Van Drew on the Doctors Caucus have introduced a good starting point. It's early, but it's a good starting point for federal legislation. And what they're doing is they are amending the Social Security Act to write in visitation. So that way, any hospital, any nursing home that participates in Medicaid or Medicare, they have to give visitation. It says 1 screened visitor per day. 2 weeks ago, I was in DC, and I got a lunch with Andy Harris. And I told him, I said, I see 2 real problems with this. I said, one, all it takes is an unelected bureaucrat to do some emergency declaration, and this is going away, right? Yeah. I said, 2, there's nothing in here about time limits. Minimum time, maximum time, anything. There's nothing about the amount of time. Because the week prior, my mom took my dad to the hospital with COVID. Thank you, Scott Miller, for wherever you are, Scott, for helping out with that. But mom took him to the hospital. And the very hospital that I was born in, all they wanted to do, he had COVID. My dad went in with COVID, and he's home, he's doing okay. But all he wanted to give my mom was a daily 10-minute visit. Full suit. Mom has to get in the full suit, and all she would get was 10 minutes. I fought like hell, got her a lot more. Administrators, doctors, nurses, common sense people fully understand that loneliness and isolation increase mortality, and having a loved one there aids in the healing process. Study after 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 study shows this. I remember reading the most lonely and isolated, socially isolated elderly patients are 2.5 times more likely to die prematurely than their most socially connected peers. Women going through breast cancer treatment, if they're lonely and isolated, are 5 times more likely to die prematurely. AARP commissioned a study that it basically equated loneliness to smoking 15 cigarettes per day. And in 2016, in the Journal of American Geriatrics, the American Geriatric Society, they found that electronic communications, like phone, email, social media, messages, video calls, do not have the same protective benefits that holding someone's hand does. We know this. The hospitals would say, well, you get to do your video calls. There's a study from 2016 that says it doesn't help. So we have big plans for the Never Alone Project. Over the course of my career working for Dobson, I've won some major broadcasting awards with some of the broadcasts that we've done. And so I have a vision of doing 2 podcasts, one a partner. Cece and I have talked about partnering together, and maybe even Kat have talked about partnering together for just getting these stories and throwing it into a podcast. A friend of mine introduced me to the founder of the Op-Ed Project, who just blasted all of her journalists that were in her network, because I was looking for a journalist to help with a 1-season podcast that tells the story of what happened, why did it go wrong, how did this affect people, and what's a plan moving forward. And I found this liberal Jewish journalist in Santa Monica, California, who lost her dad and wasn't able to be there, who wants to be a part of this. Because I fully understand that in order for us to get legislation, this can't be a conservative thing. This has to be across the entire political spectrum. And so, even though I'm a moderate, my resume from working for Dobson screams evangelical conservative. So it's a great balance. And we're going to do a one-season NPR-style show, and I'm really, really excited about it. So see me in the back for information about the Never Alone Project, and thank you all. Visitation is the biggest key. Let's get federal legislation. Thank you very much.